Hello, I am Dr. Ahilasamy from Chennai. I am going to show a case of left uncinate bullosa. That's a pneumatized uncinate on the left side with a gross septal deviation and bilateral sinusitis. You can see the coronal scan, CT scan images, gross septal deviation to the right side and a pneumatized uncinate on the left side. It is looking like a bulla et modalis. You can appreciate the uncinate which is pneumatized and infected. This is a video of the coronal study. You can watch it. Very gross septal deviation to the right side and minimal sinusitis. The maxillary, right maxillary, there is a fluid collection. You can see the FESS sign of Dr. Ahila, that the bubbles and everything, which in the surgery I will be showing. I am taking this case under local anesthesia as usual with moderate IV sedation. This is a 34-year-old female patient. You can see the pneumatized uncinate, that's a uncinate bulla, uncinate bullosa, and you can have a glimpse of the middle terminate. First step is pack the nasal cavity on both the sides with a roller gauze soaked in 4% lignocaine adrenaline in the ratio of 1:1. Gross septal deviation to the right side. Just incinate in the pack. Now I am giving the anti-ethmoidal nerve block on the left side. After decongestion, you can appreciate the uncinate bullosa. Giving the sphenopalatine block on the right side, even though there's a gross septal deviation. After multiple decongestion effect with the roller gauze soaked in 4% adrenaline and lignocaine, I am able to get some space and I am giving the sphenopalatine block. Now I am repeating the same block on the left side, the sphenopalatine block. Good blanching you can appreciate with the sphenopalatine block. Only these two blocks I will be giving. I will not be giving infiltrating other areas. Of course, I will be infiltrating the septum for hydro elevation. Patient is very cooperative. Now I am using my own design, Dr. Ahila's uncinate dissector, to dissect the uncinate. That's the uncinate bullosa. That's a pneumatized uncinate, which I am dissecting from the lateral attachment. Gently dissecting the pneumatized uncinate process or uncinate bullosa. It's a very good instrument, this uncinate dissector. It is available with Sandoz Surgicals of Mumbai. Now I am using the scissors to resect the superior attachment and the inferior attachment. And just pushing down the resected uncinate. You can appreciate the pneumatized uncinate beautifully. Did you appreciate? Yes, that's a pneumatized uncinate. And the bulla is not injured and maxillary sinus has come into open. And you can see the maxillary sinus through the natural ostia. That's a good uncinectomy. So the resected uncinate is being taken out. a huge pneumatized uncinate. Now I am going for the middle meatal antrostomy. Already it was opened by the good uncinatomy itself. Still widening the middle meatal antrostomy. Appreciate the field quality under local anesthesia, hardly any bleeding. Please watch this video with a laptop or a desktop, or pair your mobile with the TV screen. Do not just watch in mobile itself. Now I am using the Nagashima's backbiter to widen the middle meatal antrostomy. I am taking down the bulla with the Bloodless sleeve forceps. So I am doing the ethmoidectomy. Appreciate the field quality under local anesthesia, hardly using any suction, and the patient is very cooperative. The infiltration what I have given is 0.5% ropivacaine with adrenaline in the ratio 1:50,000. Now I am using this shaver to take out all the tags and the remnant superior part of the uncinate. Gently, again appreciate the field quality under local anesthesia. Do not destabilize the middle terminate at any point. It should be always medial and hugging together with the septum. The posterior ethmoid has been also opened, not much disease, so I will not be going behind. Just take out all the bony spicules and make it a smooth single cavity. Now I am infiltrating the septum on the left side. Now on the right side for hydra elevation for the septoplasty. I will not be showing all the steps of the septoplasty because I have shown it in many of my YouTube videos. So for the incision, I am using my own design Dr. Ahilasamy diathermy knife to make an incision. So the advantage is whenever you insert the scope, it doesn't bleed and fog the scope from the incision site. I am using the 15 blade knife to make the incision on the cartilage, so that I will elevate the both the side of the cartilage. The disadvantage with the diathermy knife is post-operatively you will get a scar and crusting from first to second week. Elevating the flap on the left side. Again, I remind you to appreciate the field quality. That's the beauty of doing under local anesthesia. Now I have come to the right side to elevate the flap. Most of the septal correction will be after elevating will be like the usual steps. I will not be much going into the steps. Editing those steps. The anterior cartilaginous part is being removed after making an incision in the superior part of the cartilage with a 15 blade knife. The bony spur on the floor is being chiseled out. hardly any bleeding from the incision site and hardly much fogging of the scope by the blood coming from the incision site, since I have used my diathermy knife for the incision. So now we have got a very good septal correction and a very good working space on the right side. The same steps on the left side will be repeated on the right side. Very good septal correction. Same with the Dr. Ahila's Uncinate dissector. I am dissecting the uncinate out. It's a beautiful instrument. You will not injure the bulla, you will not injure the lamina papyracea and go into the orbit. See, by good dissection you are entering into the maxillary sinus and the first landmark is coming into view. Resect the superior attachment and the inferior attachment of the uncinate with the scissors and take it without avulsing and shearing the mucosa. That's the MMA done. Full thick pus or mucopus within the maxillary sinus being sucked out. Next, the MMA is widened and the ethmoidectomy like the left side is being done. That's a ethmoidectomy. I have edited the video. Finally, a quilting stitch will be put for this septum and the knot will be placed on the left side. That's a quilting stitch with a 3/0 chromic cut. You can appreciate the quilting stitch on both the sides of the septum. Thank you for watching. See you in another beautiful video soon. Please contact me for any doubts or clearance. Bye bye.